Are you worried that your baby is spitting up more than usual? How do you know when the spit-ups are normal versus when they're not? And when are spit-ups actually problematic? And what can you do to help manage that? Well, I got you. This video is all about infant reflux, symptoms to look out for, red flags, when to consider treatment, and what you can do medically and non-medically to reduce the symptoms of reflux. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered, integrative approach to solve their children's health issues. So if that sounds like you, make sure to subscribe to the channel for more content just like this. One of the most common questions from parents of newborns is, my baby is spitting up multiple times a day. Now, is this normal? The most common reason for your baby's spit ups is what we call gastroesophageal reflux, or reflux for short. It is a physiologic process in which the gastric content, like milk in the stomach, goes upward past the lower esophageal sphincter into the esophagus. This occurs commonly in newborns and young infants as their musculature is slowly gaining strength and function. Reflux, therefore, naturally happens in 25% of infants and peaks at 3 to 4 months of age. Most of the time, it self-resolves by 6 to 8 months of age as the baby gets stronger and the muscular sphincter that acts as a control sieve becomes more functional and responsive. As for most processes, when this goes out of balance, it can lead to discomfort and symptoms that may affect your baby's growth. And this is when the term gastroesophageal reflux disease is coined. Most of the time, any pediatrician can diagnose reflux in babies based on a detailed history of feeding patterns, and therefore additional testing like endoscopy is not often needed. But it can be used to monitor the progression of the disease. Now let's talk about symptoms of reflux. It may not be so obvious that your baby has reflux because a baby with reflux can behave irritably, and it can also just from general discomfort, they just may be uncomfortable and it's hard to pinpoint the cause. However, in infants, we often see feeding refusals, crying during feeds, and back arching with their neck extended towards the back, which is a classic sign of reflux that in the medical world is known as the Sanford syndrome. Other not so obvious symptoms may be frequent awakenings, a fussy feeder, and forceful spit-ups. And if you're seeing any of these symptoms, I strongly recommend bringing this to your doctor's attention to discuss what the diagnosis may be, if it's reflux or something else, and what can be done to reduce the symptoms. Now, red flags, which means these may not be reflux if you see them. I just want to briefly mention these to bring awareness of these symptoms that definitely warrant medical evaluation so that if you encounter them, not to brush them off as reflux, as they can mean something else may be going on. Babies with weight loss, lethargy as in hard to arouse, fever, excessive irritability, and pain. And this one, I always go with the parent's instinct because they know when something is just a little bit off. Dysuria, which means pain with peeing, projectile vomiting, which is forceful vomiting, and persistent vomiting or vomiting bile. And any of these will prompt a visit to the doctor's office. The two biggest factors that I consider when deciding when to treat reflux are signs of poor weight gain and pronounced discomfort. An infant with reflux who has poor weight gain is showing growth hindrance because the amount of spit-ups from the reflux is voluminous enough that it's affecting the baby's weight gain and growth. This is something pediatricians take seriously into account, like me, because a healthy trajectory of growth is so important in your baby's first year of life. Pronounced discomfort, as in a crying, fussy baby with difficulty feeding. When parents report that their baby is crying or showing painful behaviors that are happening pretty regularly with feeds, I would more likely than not to recommend treatment because feedings shouldn't be painful and uncomfortable for anyone. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. As a holistic pediatrician, I work with families to determine the root causes with the goal of minimizing unnecessary pharmaceuticals. Therefore, to get a full picture why an infant has reflux, these are some of the questions I want you to just kind of think over because your doctor will likely ask you about it. Things I generally want to ask to get an idea of the baby's feeding and dietary history is length of feeding period, the volume of each feed, type of formula if it's offered, quality of the milk supply when breastfeeding, methods of mixing the formulas in the bottles, size of the feeds, any additives that you put to the feeds, any restrictions of allergens maybe from the mom's diet, time intervals between feedings, and the pattern of spit ups, as in, is it mostly at nighttime or is it immediately after feeds or is it way long after meals when the food and the milk comes out? And is that milk digested versus undigested? Also, family medical history and any possible environmental triggers like family psychosocial history, tobacco use, or exposure to smoke. Again, getting a full history and picture of the baby's dietary and feeding patterns help us come to the right diagnosis and plan for the right treatment. Natural interventions. There are a few tricks and natural remedies that I definitely recommend you incorporating without any need for medications. And these are options that I usually start out with my families when I encounter a baby who's having symptomatic reflux. Smaller frequent feeds. Start by reducing the volume of milk feeds and offering more frequent feeds to ensure that they're getting sufficient amounts of nutrition. This prevents the stomach from overfilling from a single feed and allows for intermission, if you will, between feedings so that the milk can be better digested. Keeping baby upright. This is somewhat controversial in the sense that studies have shown conflicting data on how effective it is at preventing spit ups. The idea, though, is that by keeping your baby upright after feeding allows that milk to move gravitationally towards the lower parts of the digestive tract and prevents the upward flow of milk into the lower esophagus. The American Academy of Pediatrics recommends if your baby shows signs of reflux to keep your baby upright at 30 to 45 degrees angle for at least 30 minutes after he completes a feed. This has been helpful in reducing the amount of spit ups in most babies that I see, but some will still have reflux symptoms like ongoing spit ups as they may occur much later after feeds. In any case, I say there's no harm in doing this, so it's worth a shot. Adding starch to thicken the milk. This can be done for breast milk and formula milk, but the limiting factor is that it only works in milk given in a bottle. So if you're nursing, this option would not be possible. To thicken the milk, you can use rice cereal, cornstarch, locust bean gum. This, from my experience, has been the most effective way in young infants under 4 months of age to lessen regurgitation or vomiting and has led to better weight gain. Add 1 to 3 level teaspoons of cereal to 1 ounce of milk. Always start with the lowest amount and avoid adding too much to the milk, which would make the milk thicker and harder to digest. And as always, before you start this, check with your pediatrician first and just make sure it's the right choice for your baby. Lastly, consider a dairy-free or hydrolyzed formula. Or if you're breastfeeding, eliminating dairy from mom's diet has been shown to improve symptoms. Oftentimes, milk allergy can look very similar to reflux, so making these changes can yield and often do yield in some improvements. Any formula change, though, should be given at least 2 weeks to truly test out how well your baby tolerates it. Also, I always recommend reintroducing milk into your baby's diet by 1 year of age, even if you tried some hydrolyzed formula and it helped the reflux, as most babies grow out of reflux by 1 year of age and can tolerate milk better. Now, I just want to say that there are a lot of misleading information out there about reflux, and there are some things that just don't work to reduce reflux symptoms, such as cutting out caffeine for the mom, cutting out stocky vegetables like broccoli, and avoiding doing tummy time, and also keeping your baby upright for a prolonged amount of time. If you try all these methods and your baby is still having symptoms that are leading to poor weight gain or pain, I would recommend some medical therapies that have been shown to help reflux. The two most widely accepted pharmacologic agents are acid blockers, like proton pump inhibitors, short for PPIs, and histamine receptor antagonist, H2 blockers. What both of these do essentially is to decrease the release of acid into the gastric and esophageal space. Less acid means less symptoms and less trauma to the esophageal and gastric lining. As a general rule of thumb, PPIs and H2 blockers should be used only in the first year of life when in the presence of esophageal inflammation and not to be continued over long periods of time. I generally do all the natural remedies first. Then if the family and I agree to try a medication, we will start at the lowest dose of one of these acid reducers and titrate upward, giving about 4 to 6 weeks of time to see if there is improvement. It is ideal to wean the medication off when symptoms resolve and also as the baby's digestive system matures. If you made it this far, thanks for tuning in. I hope you walk away with a better idea of what reflux looks like in infants, simple home remedies that you can try at home, and what options there are to safely and effectively treat your baby with reflux. This video is meant to be educational and never meant to substitute any professional medical evaluation. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.